presented by Dr. Courtney Holmes. Dr. Holmes is an associate professor in the Department of Rehabilitation Counseling at Virginia Commonwealth University. She's a licensed professional counselor and licensed marriage and family therapist in Virginia. Her research is focused on incorporating technology into the counseling profession with several projects focused on virtual group counseling delivery. We're really grateful to have Dr. Holmes and her expertise joining us today. I want you all to know that I personally researched high and low for someone to present on virtual group therapy, and she was one of very few people that we found. So we're really grateful that she was responsive and really willing to come and join us and share her knowledge with you all. Most importantly, I hope this is finding everyone doing okay. I know this is a really challenging time, and so we just really appreciate you participating, and we're here for you in whatever way we can be during this webinar. Before we get started, I want to make sure that you know the system. I'm sure most of you do. This is our WebEx system. Everyone is going to be placed on mute. If you can also ensure that you're muted on your phone or your computer, that would be really helpful. We're having a lot of participation these days, so we just want to manage any kind of extra noise that we can so it doesn't bother your participation. If you have any technical issues, please chat them to our host, Foom, who will be able to assist you. And you will have the opportunity to participate with us today. We're going to ask a few polling questions, and there's going to be a chat box that pops up for you to chat in and answer that poll question. And then there's a few chat questions for you to participate in as well. As a reminder, that chat box is on your right. And one more reminder for you. So please remember to view all OMH guidance regarding COVID-19 by going to our resource page. So Foom has put it into the slides. There's a CTAC COVID-19 resource page. We will chat that into the box right now so that you also know where to chat your questions and your participation today. Okay, without further ado, I'm going to pass it over to Dr. Courtney Holmes, and we'll go ahead and get started. Thanks, everyone.
Okay. Hello, everybody. Thank you so much for being here. I'm so excited to have been asked by Kara to participate in this webinar. This is one of my passion projects, and especially in this time, I appreciate the opportunity to feel like I can help in some way. Providers of mental health services are doing really important work right now. People are stressed and in crisis, and so our work in serving the community is really important. So thank you for allowing me to be a part of it and help in a way that I can. Today we're going to go over some challenges of virtual group work, ideas on how to manage those challenges, talking specifically about creating group cohesion, engagement, and connection. And then I'll end with some considerations when starting a new group from scratch in sort of this virtual environment. I think we'll leave about 10 minutes for questions at the end. So if there's something that you want us to help answer, please feel free to chat that in later so that we can get your questions answered. We'll start with a couple poll questions, as Kara mentioned. The first one is, how often are you or will you be facilitating online groups? And then the second is, how are you feeling about the transition to an online modality? So if you want to just take a minute and fill those out, they'll be in your chat box on the right-hand side of your screen. As you're doing that and the data is coming in, I'm just going to kind of give a brief overview of my background and talk a little bit about kind of where we're starting from. So maybe you participated in online counseling training since all of this stay-at-home stuff has happened, transition to online. A lot of those presentations and a lot of that training is on technology issues, HIPAA compliance, informed consent, and that's really important. But my understanding is that you've done that already, or you have that information from your state. So today we get to focus on kind of the fun stuff, right? How do we actually run a group online? What might that look like? What are some of the skills that we can use as providers to facilitate an engaging and therapeutic environment for our clients or consumers while they're at home? A little bit about my background. about 10 years ago, I wrote my dissertation on the Therapeutic Alliance and online counseling. At that time, could not have predicted that we'd be here a decade later trying to figure out in this kind of super fast-paced environment how to make the change and the switch and where we would be at. So my interest in that area kind of changed and morphed. I had a colleague at my first academic institution in Ohio, and we focused a lot on virtual group therapy. So we do have qualitative and quantitative data from members and leaders, facilitators of online groups. So I'll share that with you a little bit later. That will kind of guide my suggestions for interventions later in the presentation. So that's kind of where we're starting from. Okay, it looks like the polls are in, and kind of a split. Actually, about half of you will be sometimes or rarely running groups, so that's once a week, a couple times a week. About 10% of you will be often, so multiple times a week. So that's good. So hopefully this will help you be able to feel confident in the services that you're providing. And then about 40% of you are feeling pretty neutral. So that's good. That's a good place to start. Neutral's better than freaking out. So we'll take that for sure. Hopefully, again, this presentation will make you feel more confident, help you gain some skills about transitioning your groups. This is going to be our chat for the presentation. If you want to chat in to the right-hand side, what is a challenge that you're facing with regards to moving your groups online? Go ahead and use the chat box to panelists only, and we'll kind of collect those and talk about those a little bit later in the presentation, but you can feel free to pop those in the chat box. Okay, so kind of to get started, got a broad brush idea. What technology are you using, right? By this point, your site, your agency has decided what technology you're going to be using. So it's your responsibility, right, to figure out what are the capabilities of that technology, how do you use it. The more familiar you are with it, the better you're going to be creative in that environment to help engage your clients in the therapeutic relationship online. There are some nuances, right, with technology and how people actually connect to our therapeutic services now. You know that we can connect through phone or computer. And for individual work, a phone connection makes a lot of sense, right? One-on-one, it's really not a huge inconvenience or distraction if people are on their phones in video conference therapy. But for a group, a phone connection might actually limit ability to participate in group work because there's multiple people on the call. You don't really have a good view of the participant's nonverbal language, and you really are kind of missing that sense of connection and the group as a whole. So something that your site, your agency, you want to start thinking about is what are the kind of the rules going to be? What are the expectations going to be for clients? Will you allow people to participate without video? Will you allow people to chat in the modality? And then what constraints do your clients have with regards to technology access? Right? That's a huge issue. We don't want to make assumptions, you know, that in an ideal world, right, maybe we would run our groups, everyone would have a computer with a camera. In reality, that's probably not the case for a lot of our consumers. So we want to make sure that we're allowing flexibility for that depending on what technology people actually have access to. The overall type of group you're facilitating, that's going to also guide you. So as we transition to this online modality, just kind of hold firm in that overarching goals and structure of your group, right? Remember what type of group it is: support, psychoeducational, skill-based, theory-driven, process-oriented. All of those groups can function online. It's just a matter of how, and each one might look a little bit different with regard to structure, how how the leader actually intervenes. And so just something to be thoughtful about, something that we might take for granted when we're in face-to-face groups and we've been running these types of groups for a long time. Just remembering that actually the type of group and the goals for that group really are going to guide how we facilitate it online and what that might look like. Okay. So to start your groups, this is some information that has come out of a lot of the trainings, and it's pretty basic baseline crisis stuff that you want to pay attention to. To start every session, it's best practice to make sure, confirm with your clients that they are at their house, and if they're not at their house, that they can give you the address of where they are. And that, of course, is to protect you and protect the client. If a crisis were to arise in the middle of a session, you would be able to know how to intervene. So just at the end of each session, do quick confirmation, where are people at, and then you'll be able to document that in your case note. The second part is to make sure you have crisis contact information handy during your sessions. I did a training a while ago, and one of the facilitators kind of talked about a freak accident, right? Like they're on the call, power goes out, and so all of a sudden the therapy session's disconnected, but also she can't log into her management system to get the client's number and can't follow up because all of the power's out, basically. So it was suggested to have kind of like a running list on paper of clients, the family contact information, police contacts, just crisis response stuff. Talk to your supervisor about that. There might be rules about taking stuff off the server, putting it on paper. But that's one option if you're worried about power going out and not being able to access anything online in the event that you do get disconnected. Okay, so another kind of overall thing to consider. This is stuff that you might have talked to your clients about already. It's possible that you've done individual sessions or phone sessions with your clients to kind of prepare them for the transition to online work. Even if you did do that, I recommend starting groups with this information. I'm a big kind of proponent of like the more structure we can provide in the beginning, the more clear expectations are, the better that's going to set the group up for success over time. You can always kind of loosen, expectations and things like that when the group can tolerate that. But it's always harder for me to like add in structure and stuff after we've already started out pretty loose. So spend time in that beginning session really talking about this stuff, making sure the group is clear, having conversation that allows members to ask questions and clarify some of the things that we might feel are that people know or are standard and how we understand communication. We really actually do need to spend time on talking pretty clearly about. So just in that first session, spend time going over how it's going to work, what the client can expect from this kind of treatment, what your role is going to be. One of the big things and best practices of online counseling is talking with the client about what's going to happen if you get disconnected. So having a policy in place about what that's going to look like. And then that will be talked about with each client. You know exactly what that's going to look like. And so talking with your supervisor or your agency, what's your policy about that? What's the expectation for you as a provider? Sometimes that looks like if you get disconnected, the client might take a few minutes to kind of log back on. If that doesn't work and they don't log back on, then it's the clinician's or the provider's responsibility to call the client after the session is over to touch base, and then you can document. But that's probably going to be policy driven by your site. So just talk about that if you haven't already with your supervisors. And then thinking about your own space, right? Their space and your space really matters, and that can't be a conversation that you skip. Really have to kind of set those boundaries around being in a private place, minimizing distractions as much as possible. I mean, especially if you're working with adolescents and teens, that's going to be a really critical conversation conversation to have. So that needs to be super clear, right? People might not completely understand exactly what that looks like. So just be prepared to like really talk about that and make that very clear for everybody.
That sounds great. Courtney, I just want to interrupt you for a second. I'm so sorry. We're getting a lot of chat that says that your audio is going in and out. Would you be able to just maybe move the mic up closer to your mouth while you're talking? Because I don't know what's happening. It could just be our WebEx system. I'm so sorry, everyone, if you're having a hard time. But I was wondering if maybe you could just move the mic up or take out your headset. I don't know if
Let me try.
If it's the headset.
Is this better?
Hold tight, everyone. We're gonna fix this. I know we saw a few chats, and then when we saw a few more, we realized it was probably not necessarily the other person's line, but your audio. So let's see what we can do to because I want to make sure people hear. Oh yeah, that's better. That sounds better.
Okay. All right. I'll just try and hold this up, and then if it's still going out, I can take out my headset.
Okay, great. Thank you. Sorry to interrupt.
No problem. Thanks a lot. So it sounded like a lot of the participants on this call today would be working with kids and adolescents. So I focused a lot of my information on that population today. So thinking about participation with young children, one of the transitions that might need to happen from face-to-face work to now this online context is that parents and caregivers may need to be more heavily involved to help the kiddo really participate in therapeutic services. So this might be something that you plan to work out with parents before you start your group. What is their role going to be? What's that going to look like? You know, I have friends whose preschoolers are doing Zoom video conference with their classes. So it can be done. Parents just might need to be more involved, setting up the technology, helping with any kind of like creative arts or things that you actually want to do in session. So just thinking about that ahead of time, you know, what caregivers need to be brought on board, how you can help structure that for them so that the kids really can engage, you know, developmentally what's realistic for them to be able to do this. Moving into adolescents and teens, you're probably going to spend a lot more time here talking about the boundaries, really kind of focusing on what's okay to wear. That seems like maybe you wouldn't need to do that, but we definitely need to do that, even with adults sometimes. So where can you be? What's confidential? What's a space where you can be in? What's appropriate? And really kind of helping them think about how an online environment is going to be therapeutic and different than some of the technology they engage in their regular life, right? Really helping them kind of make that jump, like what are their goals for the group? What do they want out of it? How can this space be separate from other types of things you do online with friends and family? Using their home environment in a way that's therapeutic and thoughtful. We'll talk about that. And then some interventions, we'll get to those as well. And then for those of you working with adults, realistically, it's not going to be that different. You're still going to want to do a lot of the structure, a lot of that discussion. Adults need that kind of safety planning stuff as well. So hopefully this presentation will hit any population you're working with. You can take any of my suggestions and mold and shape them to meet your needs. So these are suggestions, and you can kind of fit them into your own context, what your client population looks like and what their needs are. So you notice at each end of those slides, there was a question, is home safe? We know that family and intimate partner violence increases during times of stress. I'm sure you're seeing that. We're reading that. And so it's more critical now than ever to make sure that we're assessing for this, that we're paying attention to the safety of our clients while they are in their homes with kind of stress building, negative coping patterns building. So there's not a ton of guidance about this. In fact, up to 2 months ago, we were pretty clear that people experiencing violence in their home weren't good candidates for online counseling. You don't want to bring counseling into the home when it's not safe, but here we are in this environment where like now we're doing that. So we're kind of scrambling to figure out how can we provide services to people who are in this situation. So I reached out to some people that I know that work in shelter environments in Richmond, kind of pulled together some suggestions for you. And when you start your virtual sessions, just using verbal cues to check in, right? Is now a good time to talk? Do you feel comfortable talking? You might need to help kind of take more initiative to help clients sort out safety issues. You might be able to see or hear people in the background. It might not come immediately to clients to be like, oh, I need to move to a new room or think about that. So we might need to sort of be more directive. Like, oh, I wonder if you could move to a new room. Where's a space you could go that might be more private? Some of my contacts were saying how some of their clients actually take their calls in their car because that's safe and out of the house and separate. So, before when we were talking about having people be thoughtful about where they're going to be for video conference or for their therapy, we might need to be a little bit flexible with that, particularly when their home isn't safe. So just be thoughtful about how we need to be flexible with where people are at if it increases their safety. Potentially using a safety word for a client to signify if a person's come in the room or it's no longer safe for them to be on the call. Everybody should hopefully be using headphones, and so that's us, any client, whether or not they're in a safe situation or not. It helps confidentiality issues for all people participating, but it also cuts out external noise and distraction. So that's something that you would want to be talking about, with your clients in the beginning. Do you have access to headphones? Can you use them during our calls? When you're working with kids, most likely one parent has consented to treatment already. It may be worthwhile to work with that consenting caregiver about kind of setting a private, safe place for that kiddo to participate in the therapy. You just might need to bring them on board to establish sort of treatment expectations and how you might need the parent to be involved in that way. And kind of re-go over reporting emergency protocol if something were to happen. What are your reporting duties? Know really clearly how you would react in a crisis. So talk with your supervisor and make sure that you know who to call, what that would look like, and just kind of an awareness around technological control that perpetrators might use. Looking at past history of websites, and then if you need to bring in, the consenting parent, talk about that. You should do that. Okay, so now we'll kind of get into our online group work, what that's going to look like. So one of the things.
Courtney, sorry.
No, it's okay.
It's me again. Sorry, everyone. Hi. I think we're still hearing that the audio is a challenge. I think if you unplug your headphones and just speak into your computer, that may work best.
Okay.
Okay. I'm sorry.
Oh, that's all right. Is that better? Okay. Can you hear me?
Yes, that's great. That's great.
Okay. Sorry. I have a toddler at home, so the headphones were to keep her noise out, but I think she's actually gone for her nap now, so it should be fine. All right, will you just pop in again and let me know if we need to readjust or something? Okay, so really thinking about online group work, it's going to be different. It's going to be a transition, and that's okay. So really normalizing for our clients, for our consumers, that this is going to take a little while for us to kind of get the hang of it. It's going to feel different, so don't be discouraged if it does take a little bit of time for us to get our footing and figure out where we're going. So you can spend time in that way, just talking about that, exploring, what a client's fears are about this modality. Do they have hesitation? Do they have resistance? What's going on for them in making this transition? Understanding too, if you're working with kids, that most kids are technology savvy now, but not making the assumption that they know how counseling is going to work, right? How therapeutic relationships are going to work online. So that's also a really important discussion to have in the beginning. How is this going to be different? How can you treat this space differently and engage in a way that's going to be helpful for you over time? Then the last thing is just, as always, exploring our own bias, our own hesitation. You know, it's probable that a lot of us are in this position, like, I didn't ever want to be an online counselor. And here we are being an online counselor. So, you know, just exploring a part of us that does have fear or worry or concern, our own resistance, and how that might play out in our work. So some potential pitfalls that, and these came directly out of our research that we've done. And I actually wanted to check the chat quickly because I think you guys have been typing in a little bit. Okay, so some things a lot of people are chatting on about engagement. You know, how do I get people engaged? How do I get people participating? That kind of thing. So perfect. We'll talk about that. So a lot of our research has talked about some of the barriers and some of the challenges that we're going to face. And if you've been doing it, you've probably run into these barriers already. You know, it doesn't really feel like rocket science, right? We kind of understand what the challenges are. When we think about what is the purpose of group therapy, right? We think back to kind of Yalom's curative factors, what makes group effective, what makes group healing for people. That's, you know, when members can feel like they belong, right? They have a sense of connection and cohesion with other members. Like, that part of group is really, really important. And so part of our goal as facilitators in this way is to make sure that we're not losing that essence of group, that really important part of what makes group work. However, that said, the technology context of online group cuts directly into those things that we're supposed to be facilitating, right? It's really, really, really hard for us to help people feel emotionally connected, right? A lot of our qualitative data has come up with these themes that kind of showcase it's really hard. People don't feel emotionally connected in group. It's really easy to talk only about surface level things about your life, to feel like it's more of a chatting conversation. It's hard to be authentic. It's hard to feel as if other members are authentic. It's really hard to get out of your own space. There's so many distractions. So we feel hyper aware of our environment. That's hard to kind of get over and sort of really participate in a group the same way we did face to face. Another thing that came out of our research was the feeling of it being really linear. And maybe some of you that have started this already can kind of get that sense. It's really easy for us to become teachers and for members to feel as if they're students. So we get that kind of sense of like, I'm in charge and it's my responsibility as the leader to just ask questions, right? How are you doing? What do you feel about that? What's going on for you? And it kind of becomes this linear process of me just asking and people answering, right? And that's not a group. One of the things that we want to happen in a real group, right, is that members spontaneously share. They start giving each other resources, supporting one another, connecting with one another on their own. That's what we eventually want to have happen in groups when they form. And that's really hard to do in an online format. So that's something we really want to be aware of and intentionally try to work around or work against. Just be aware of our desire to fill in silences. When we feel like we need to fill in silence, then we do talking for the clients, and then we drop into that kind of linear sense of how things are going. And it's a lot easier to intellectualize and talk about content. And that kind of goes back to that lack of emotional connection, that lack of sincerity and authenticity. it's really easy to just talk about things. And so we want to make sure that we're really intentionally pushing therapeutic engagement, meaningful engagement, and not just talking about stuff. Okay, so in some of our quantitative research, we looked at what skills facilitators thought they used while they were leading groups. And ironically, the things that we would want group members to be able to do, the things that actually create group cohesion, they thought were either really difficult to use or they didn't even use at all. Okay, and that's drawing members out, facilitating communication, creating interpersonal interactions. Those are inherently hard to use in an online format when you're running groups. So we kind of like need to get back to our training, get back to our roots, and really intentionally use our basic group facilitation skills, more so than we may need to do that in a face-to-face environment, right? Like we practiced, we have been running groups for a while, and so things like come pretty naturally, and maybe we don't need to be as intentional about what skills are we using. In this environment, especially as we're transitioning, we may need to be more thoughtful about using the things that actually create the group engagement. So don't be hesitant to draw out or use direct, people's names. Help people to feel comfortable as if they'll share. People will usually just sit there, wait for the leader to call on them or to create some kind of conversation. So we want to help practice drawing members out, asking them to share, not allowing members to just sit for 50 minutes and not participate at all. Really intentionally linking what people have said, creating that kind of sense of cohesion and universality. Paying really close attention to the focus or redirecting. This might be more useful in an online setting. There's a lot of stuff going on. Helping people stay on the focus will allow the opportunity to create depth. Cutting off when necessary, asking targeted questions to deepen the focus. Just your awareness that it's a lot easier to stay on the surface. As a facilitator, you're going to want to be intentional in helping them get to the meaning part. Talking about feeling, you might need to do this more often. Incorporate feelings words, ask about feeling, maybe in a way that you don't necessarily need to in face-to-face. In this environment, pushing that or being intentional about how you do that, how you ask about that is going to help a lot. So just generally kind of be prepared to work a little bit harder at facilitation in the beginning. You're going to be the person who sets the culture and the expectation about how members are going to participate in that group. And so if you're on the front end, you're using your skills to help connect that engagement, that's going to help a lot, and members will follow what you're doing. It doesn't come naturally or easily in this format for interpersonal connection. And so because of that, we just need to increase our attunement to that and more directly focus on that while in the group. So again, just going back to your basic facilitation skills as a group counselor. How do you connect each other? How do you link? Right? How are people relating to someone who's shared? It's really easy in this environment for someone to share and then the group to move on, for someone to share and the group to move on. And we really want to avoid that, right? Because then it becomes that linear, like, okay, I said something, she said something, he said something. We want to create an environment where someone shares and then we are able to process that piece or create depth about that piece, create cohesion and connection and universality around that. So again, just that falling back on your skills, your basic skills, and really utilizing them to help facilitate that crosstalk and that spontaneous sharing between the members. So here are some ideas, some options that you might have. Since we are online now, we do have some different opportunities to learn about people's lives, to get a sense of who they are. So especially like when you're working with kids, right, they want to show you things about their life. They want to show you, things that they have in the house, things that are important to them. So use that to your advantage. obviously to an appropriate and boundaried degree. But have kids show you things in their home, using physical representations or embodiment stuff from their house can really help create conversation and engages that other part of our brain, right? And so have kids show you things that represent a part of their identity, how they feel, what they're doing to cope, something in their house that represents their family. So you can be creative with that, but have kids bring stuff in to show the group and use that as dialogue. Another option is using kind of games online or exercises, even for group warm-up, that directly get at that engagement piece and that interconnection. So things like Simon Says or online charades or using I Spy, using others' backgrounds, you're automatically facilitating interconnection with people and taking yourself out of that sort of like teacher role of I'm going to ask questions. Those types of games immediately facilitate interconnection, and those can be really helpful in helping people feel less nervous, more connected, that kind of thing. So have fun with it. Have your members have fun with it. That's, a good way to get kids engaged, especially in the beginning. So using technology, we have access to things now that were on our computers that maybe would have been difficult to bring into group sessions before. So now we have access to video clips, podcast snippets. Be creative. Use things in your session that spur conversation. Using multimedia, stuff like that often helps groups think differently about topics rather than having, that narrative question and answer format only. So be creative about the things that you bring in and how you can use them in group to create a dialogue. You can even have your clients or kids share songs that represent things to them. Have them share like appropriate memes that mean something to them over the past week. So be creative. Have kids bring in things that represent something to them. I'm sure you have all heard of Web 2.0 activities, but those are essentially, interactive websites that we can use to do kind of immediate sharing and connection with each other. Timeline apps can be used to, clients can go on and they can use pictures off their phone, like video, pictures off the internet, and create either a past history or a future history. If you're having kids talk about their future goals or what they want their future to be like, they can create a future timeline. Creation and collaboration apps, some examples are Padlet or Poplet. I'll talk a little bit about that in a second. Using web whiteboards, so places where you can all create something, co-create something at the same time. So using pieces like this helps, again, spur creativity, spur engagement, and kind of gets out of that trap of like question and answer. You can screen share if you want to use, an activity sheet or a worksheet that you have. Members can share their screen too, so that's always an option. You can use breakout rooms for small group discussions, which is super helpful in groups. Especially when people are starting out and just starting to get warmed up and feel comfortable. And then use the polling feature, kind of like we did today, to kind of spur conversation. Here are two examples. The top left is an example of the web whiteboard. So that's, again, a live link that you can share to all your participants, and you can kind of co-create at the same time on there. So you can use that in a billion different ways. But then everybody at the same time can kind of add to a drawing or draw something and you talk about it. And then the bottom right is a Padlet, which is essentially like a big board that all the members can have access to at the same time. And so this was an example of something I used in one of my classes for group therapy. And at the top, I put up prompts that clients might say in a group, and then the students were in groups and they had to talk about how they would respond as the leader if someone in their group had made that statement. And then they went on and added the responses underneath. So afterward, we had kind of this big board of people's responses, how they would interact with the members of their group, and it created great discussion, and we had so much fun with it. So you could use that in billions of different ways with your groups. Coping skills, anger management, and pretty much anything. So get creative with it and use it any way that would fit for you. And Padlet and Poplet, all this stuff is free usually, so you can just do some Googling and see kind of what comes up. But a lot of it you can get for free. Okay, so again, working with younger children, just thinking about developmentally appropriate interventions for your age group. What can you realistically expect them to do in this format? And how can you structure it for them to engage? So again, thinking intentionally about how parents might be involved or might need to be involved to help the kiddo participate. And if you need to kind of change the therapy a little bit to be more about the parents supporting their child in this way if the kids are really young. So it just depends. It depends on your population and what their needs are, but that's something to consider. But remember that young kids can use their own toy or board games and involve you in their play through video. You can turn a board game into something that you may use in a therapy session and share between the members. You know, still use your creativity. It just might take a little bit to figure out how you can do that in the online environment, but pretty much anything you can do in person, you could do virtually. Use your puppets, use your books, use the things that that you would use. Okay, so kind of an overview of the context, which I'm sure this is not news to you since you've probably been practicing already in this environment for a while, is that just to expect our clients are going to be in crisis to a certain extent, right? We're living in, an unprecedented time. Stress and fear and anxiety, grief, confusion, all of those things are really coming to the surface. So whatever we were working on in therapy maybe before this happened, we might need to reevaluate that. And so especially in our groups, when we're planning for our groups and we have maybe curriculum we're supposed to be doing or group plans, are we flexible enough to allow clients the space to talk about the things they need to with regard to the crisis that's going on? So just planning to be flexible to accommodate clients' needs around the COVID stuff. Just plan and expect that you'll need to do risk assessments and potentially intervene. So again, just talking with your supervisor, your agency, making sure you know how to do that, what that's going to look like. And then just remembering developmental issues for kids when they're in crisis, right? They are likely to have developmental regression, express more somatic concerns, and that really there's a need for them to express other ways than verbally in these kind of times. So anytime you can integrate creative expression into your groups, that would probably help a lot. Okay. And then the last couple minutes, we'll just talk briefly about setting up a group in case that's something you're called to do, is start a brand new group in this environment. Remembering that planning is still critical, right? A solid group plan and curriculum, an idea of the goals of the group, where it's going to go, that will help you guide yourself as you are kind of setting up what that group is going to look like. And then kind of getting into screening. We can't always screen, but when we can, it's really useful to us. And in this situation, it's probably even more important that we do, just because we want to make sure that the group is going to be able to function in a way that's okay for members. So a lot of the screening questions would be the same. Okay, so remembering what kind of group you're running and what kind of client or consumer would benefit from that group, who would be a good fit, right? Personality-wise, diagnostic-wise, motivation for group treatment, and then who's going to do it, right? Who are the both, are the co-leaders going to do it? Are you going to use a phone call, video conference? Just kind of the logistics of how that's going to work. And then finally, the additional pieces you want to add in to that are really screening around the desire to participate in an online format. And then kind of getting back to that very first slide, what is the technology that you're requiring? Are you requiring video as an agency? Is phone okay? Is text okay? Some clients aren't going to want to do video, and they're going to request that they can participate phone only. And is that something that you're okay with? Is that fine? And if it is, that's all right, but just making sure that that's clear. And that's been something that you've talked about with regard to how that's going to work. Again, assessing for safety of home environment and other imminent risk. And then, again, thinking about how the parental role might change when you're working with kids in this context, and how you want to boundary and structure that to make sure that those aspects are really clear when you start. So I think that's it. So in summary, just be patient with yourself as much as you can. We're all learning a new skill. We're all transitioning in a way that can feel overwhelming. Plus, like, we're at home with our families and our kids, and it's scary for us too. So we might not be our best therapeutic selves some days when we're, feeling overwhelmed. So just try to be patient with yourself, knowing that you really are doing important work. The community really needs us to help them, and you're really making a difference in people's lives. Continue to be creative, and don't let the technology block your creativity. In fact, maybe use this as an opportunity to try new things, maybe that you've been wanting to try or haven't figured out how to bring into group yet. And then just kind of that intentionality, right? Being online doesn't make boundaries or expectations less important. In some ways, it makes them even more important. And so not taking that for granted, and really kind of digging into your role as a leader. You're the person who's structuring this for your clients. You're the person who's going to be in the best position to help them engage in a meaningful way over this process. So yeah, so I think that's everything. I hope that was helpful for you. Okay, question and answer.
Sorry, I was on mute. So thank you so much, Courtney. I think this was incredibly helpful for so many reasons. And we did have a lot of questions that came in. So I'm just going to go through a few of them. We have about 13 minutes left, and we're going to start with this one. How do you manage a group with some people on video and some not, especially if you use some engagement activities such as video or memes?
Yeah, that's a super good question. And that's sort of something that you want to talk about in the beginning. So when we, have that conversation, right, with our site around what's going to be the expectation for people to participate, what that's going to look like. When we do allow people to participate without video, which, in these times is probably the flexible, inclusive way to do that, we're knowing that there's going to be some things that are missed for people who are participating on the phone only without video. So some of that just might be intentionally setting things up prior to the group, or talking with the group about the limitations. When you do participate only phone, here are some of the things that you're going to miss. So if it's possible to use your video, that would be great. And if you really can't, then these are some of the things that you just might not be able to do. So just kind of setting that up front. I mean, if there's ways for you to get, obviously email and stuff is something that you'd want to work out and informed consent, and having people, consent to that way of communication. But if you can send out activities or things that you're going to be doing in group prior to the group, that might help kind of get information to people before the group starts so that they can still participate even if they can't see whatever you're sharing in the group. So there's just, yeah, things might be missed, and that's not ideal, but if we're trying to engage people in a group and that's the only way they can do it, how can we work around that to do as much, get them as much as we can?
Yeah, sounds great. So really, again, going to that first conversation you have when you first begin your group virtually, that's important. So that's really helpful. Thank you. What would you say would be the group size cutoff to allow for the group to be beneficial to everyone?
Yeah, that's a really good question. Online, you probably want to have less people than you would in face-to-face. I mean, I think in face-to-face groups, especially if you're trying to do any kind of process, 10 or 12 is usually a good size, a big size. I would say online, if you could keep it to 8, that might be ideal. Or 6, with kids, you probably want to have smaller groups as well. So you can take that into consideration. So if it's allowable for your site and that's a thing that you can be flexible on in terms of how many people to a group, I think the smaller in the online format, the better, just because you will have more management over how people interact. The larger the group size online, the more it's going to feel like a class. And that's similar to face-to-face too, right? The more participants we have, the less process we can kind of get to. It does feel more like a class. So yeah, somewhere around like 8 would maybe be a pretty good number. But you could go a little bit higher if that you needed to for your site. You just have to kind of be a little bit more intentional in how you facilitated that.
Great. So it sounds like you're suggesting that the more participants you have, the more likely you would be to kind of get into that teacher role that you were talking about.
Yes. Yeah.
Yeah. Right.
But sometimes there's with just like the way that things work, we can't get to have our option of like, oh, I'd love a group of 8. Mm-hmm. And that would be perfect. So to the extent that you can, that would be ideal. But
yeah, great. I hear you. Thank you. In a group setting, sometimes kids want more attention than others. How do we address this in a group setting without impacting the setting or tone of the group?
Yeah, good question. In that case, I mean, I think that some of that would be similar to how you would handle it in a face-to-face group. You'd probably want to structure it with that kiddo. You'd want to do your cutting off. You want to do kind of your redirection. That in this format, depending on how that kid's acting and what kind of things they're doing for attention, you may need to get a parent involved just to kind of help maybe facilitate some of that participation a little bit differently. I guess some of my answer might depend on what exactly that looks like, but I think you're probably doing a lot of the same skills in terms of cutting off and redirecting and helping the group, move forward without that kid kind of like having all the power.
Yeah, makes sense. So using some skills you would typically in person and may have to involve caregivers. These are really excellent questions. We have so many, actually. So I'm going to go through a few more if that's okay.
Sure, yeah.
So technology, when you asked about challenges, technology kept coming up, and sometimes technology is a real issue for people, understandably so. So have you ever conducted a group with only people on the telephone? And do you have any ideas about that?
No, I haven't. And I think that would be really hard to do. But again, I mean, it kind of goes back to like, that would just take practice, right? And that would be probably a situation where you would talk with the members, like, this is going to be hard. And there's going to be things about this that are going to take a little bit of time to learn how we're going to participate with, just really kind of structuring and normalizing that that's going to be different. And in that case, you wouldn't necessarily be able to rely on any nonverbal information at all. So that might be a situation where you might need to actually be a little bit more of that teacher, because participants wouldn't be able to really know when they could jump in or how to carry on that conversation. So that just might be a scenario where the leader is doing a little bit more of that facilitation to actually draw people out and ask people to participate because of the true lack of nonverbal communication between the members. So two things, validation and normalization, that it's going to be, it might take a few weeks to feel comfortable, and also that you'll help kind of facilitate the dialogue more efficiently as the leader, while people kind of get warmed up to it, and you can draw people out that way.
Great. That makes a lot of sense. Thank you. Someone is asking about getting teens engaged, so that it was challenging before in groups, and now it feels even more challenging. Any suggestions around specifically getting teens engaged in groups?
Mm-hmm. Yeah, I mean, I think that's, now that people are home, it's there's a barrier, I think, to kind of prioritizing something like this. Several years ago, we ran a study with a virtual academy in Ohio, and our students ran virtual groups for their at-risk youth in the school. So it was kids in like 10th and 11th grade that were on the barrier of failing out, and no one ever came. I mean, one of our biggest problems was getting kids to come to the group at all. So that's part of it. I don't know how you at your site would try to get the teens to come to session, how to engage them when they had to come to the office. But you could even maybe transition some of that to the online environment. Maybe even try to talk individually with the teens before you start the group, kind of talking about your hopes for the group, how you think it might benefit them, engaging them in a conversation about what they want out of the group, kind of that maybe one-on-one discussion first to help carry over some of their motivation to continue their participation in the online format. That's a hard one.
Yeah. Engaging teens is challenging for groups. Maybe I wonder if it would be helpful to have some kind of teen champion support the work in some way. Yeah, I don't know. I'm just throwing things out there. But I think we have time for one more question, everyone. And so this question is, if a client doesn't feel safe in their home, is it appropriate to suggest conducting a virtual group or group therapy outside or to a park if weather permits, as well as social distancing, as long as we know exactly where they will be?
Yeah, I think so. I mean, the ethical consideration about that is making sure the client's safe, but also making sure that you know where they are. So if there's negotiation that you can do with the client for them to find a place outside the home that's going to be safer, but also you would be able to get a crisis team there if you needed to, that seems like it would be fine, and then you'd be able to document that. I mean, the other piece is that you want to make sure they're in a place where the group would be confidential too. So, if they can confirm that they're in a space where if anyone's talking in the group or they're talking, that the confidentiality is withheld for that group in a different space. I think like that would also be part of it too. But that seems to me like it would be appropriate if you can manage those pieces.
Yeah, great. Thank you so much. I think that's all the time we have for questions. Everyone, thank you so much for all of your participation. We really appreciated you joining us today. And thank you, Dr. Courtney Holmes, for sharing your expertise with us. We're really grateful to have you. I think this is a really important discussion. Sorry for the earlier audio issues, but I think most people seem to have been able to hear you, so that's great. These are some of our upcoming events. Just so everyone knows, we have from in-person to on-screen best practices in telemental health today at 2 o'clock. So you could take an hour break and join us again at 2. That's going to be a really important webinar as well as virtual group therapy. We have Dads and Depression, looking at paternal depression in new and expectant dads. This is something we haven't really talked about before in CTAC, so we're excited to have Dr. Lena Green join us for that. And then on Monday, April 27th, we have Helping Kin Care Families Cope with Ambiguous Loss, and we have Transition Age Youth Engagement, Best Practices and Personal Experiences on April 30th. So we have a lot going on. We do want to make sure that we are giving you some helpful and important information during this crisis. And once again, I just want to thank you, Dr. Courtney Holmes. And do you have any last words for our audience?
No, thank you so much for having me. And yeah, sorry about the audio, but I'm glad it worked out. So
it worked. Great. Thanks so much. Take care, everyone. Hope you have a great day. Bye-bye.